everybody. Today we want to share some women's fertility facts with you. We think that women's fertility is not talked about enough and there's a lot of misinformation going around, so we are going to share some facts with you.
I'm just going to start off with some basic facts about fertility. The first one is that women are born with all of their eggs. They are not going to grow new ones as they get older. Fertility starts slowly declining in your late 20s and then it becomes more noticeable after 35. Your cycle can tell you a lot about fertility. Your period can be a window into your reproductive health, and irregular cycles may signal hormone changes or other issues. Your lifestyle matters a lot when it comes to fertility. Sleep, stress, nutrition, smoking, and even extreme exercise can all affect fertility. One of the main misconceptions about fertility is that it is not just the women. About 1 in 3 fertility challenges come from the male partner. Knowing your body is super important. Tracking ovulation, paying attention to symptoms, getting checkup early can help you make informed choices.
So endometriosis is one condition that can impact women's fertility. Endometriosis is pretty common and it impacts an estimated 1 in 10 women worldwide and 11% of women aged 50 to 44 in the US. We don't have one single cause that we know of, but there are multiple theories that suggest it's a complex disorder. It's often a painful condition in which tissue that is similar to the inner lining of the uterus grows outside of the uterus. It often affects the ovaries, fallopian tubes, and the tissue lining in the pelvis. This tissue acts like the lining in the uterus would. It thickens, breaks down, and bleeds with each menstrual cycle, but it grows in places where it doesn't belong and it never leaves the body. It can cause cysts, and surrounding tissue can become irritated and form scar tissue. Symptoms include painful periods, pain with sex, pain with bowel movements or urination, and excessive bleeding, and it can also lead to infertility. Doctors suggest to see a doctor sooner rather than later if you're experiencing any of these symptoms, and treatments include over-the-counter pain relievers, hormone therapies, and in some cases surgery.
We also want to talk about PCOS and bring a little bit of awareness to this condition. PCOS is a metabolic and hormonal disorder that is caused when the body produces too much insulin. It then causes the ovaries to produce testosterone, which causes a lot of fertility issues and struggles. An estimated 6 to 12% of women have PCOS in the United States, and it specifically is beginning to affect younger women, mostly in their 20s, and it's becoming a more well-known diagnosis that women are being treated for. Some symptoms for PCOS are inconsistent or irregular periods. Also, many women just lose their periods completely. There are also issues with hair thinning, weight gain, and fatigue. Also, many women experience mental health concerns, which they need to be treated with medication. Some long-term outcomes of this condition are infertility as well as type 2 diabetes. Because the insulin level is elevated in the body, this can cause issues in overall long-term metabolic health. So it's recommended by doctors to get consistent blood work done as well as taking the medication needed, such as metformin or supplementing with hormone therapy to treat the PCOS and manage your overall symptoms long-term.
If you have experienced any of these symptoms, we recommend talking to your healthcare provider as soon as possible, and always stay informed about your own health.